thothoretsa la fosa la duba la thothoretsa la nepa bokone bophirima Morena Mabuza. Morena Mabuza tata tabethe ulutonga umshengu indaba esikhanyilanga ngwani wena wengwazi utonga la mavuso lowa katabeta umuntu ngokwakhe wasimba inkani nathi inkosi khona enkosi nathi inkosana sinathola sibuye sikhombe emakhosi lesinkothana wena mavuso nkosi Dlamini Shabalala Mabuza.
Thank you very much. Thank you. Program Director, MEC for Health, thank you for the opportunity. Our host, the Premier of Northwest Province, Professor Muhoro, Minister of Health, Dr. Zwelini Mkiz, Ministers who are here, and Deputy Ministers, Deputy Chair of SANAC, Ms. Steve Litsike, the Executive Director of United Nations Joint Program on AIDS, Ms. Winnie, who has just left, MECs and mayors, councillors amongst ourselves, members of SANAC, Board of Trustees who are here, our Chair of the House of Traditional Leaders, Hoshimabe, thank you for gracing this occasion. Distinguished guests, ladies and gentlemen, Dumelang, Sanbonani, Ninjani. Once again, we meet today on this commemoration of World AIDS Day, not only to remember those lives which were lost to HIV and AIDS, but we also meet to celebrate the positive strides we have made collectively in our fight to end HIV and AIDS as a public threat by 2030. We have chosen to commemorate this year's World AIDS Day here in Matlosana in acknowledgement of the prevailing challenges that are faced by people in this municipality. Our people that are infected by HIV and AIDS and all other social ills that are confronted by our people on a daily basis. I want to thank the leadership of this province, especially the Premier, the MEC, for finally making it a point that we have got the Provincial AIDS Council. Premier and MEC, this is the beginning of a long journey. But I'm happy that you have started this journey. It's a very difficult journey. And now we are going to walk this journey as a collective. You did very well by bringing civil society, by bringing business and government to work together to deal with this problem. We are confident that working together across all sectors of society, the people of this province will join the other parts of the country in taking the fight to defeat AIDS and TB. We are particularly pleased that this year we are joined by the new Executive Director of the Joint United Nations Program on HIV and AIDS, Ms. Winnie, who has just left us. She has given us a message. She is an activist of note, a distinguished advocate for human rights and development. We have no doubt that her vast experience in political leadership, in human development, will take us forward in the struggle to end the AIDS epidemic. For our past as a country, our journey and contribution to the vision of zero infections, zero discrimination, and zero AIDS-related deaths has been long and difficult. There was a time when every week, in every community, the pain of losing someone to AIDS-related illness was a common phenomenon. We are today acknowledged by UNAIDS and others as a global and continental leader in our HIV response. This is precisely because we have implemented progressively and comprehensively all the policies that we have agreed to implement in order to respond to this epidemic. We could not achieve this without partnership and support from all our global partners. That is why we must appreciate the contribution of the global campaign by UNAIDS that galvanized all of us as political leaders, civil society and private sector into a coherent action. We're also grateful for the unwavering and continued support from our partners, in particular the United Nations family, the United States government through its PEPFAR program and the Global Fund. We want to say thank you very much for the support. Your continued support will see us through. We want to say your support is not in vain. We appreciate it, and we commit to work ourselves flat out in order to confront this challenge that is facing our people. What we can assure you is that we are confident that we are going to overcome. As the South African National AIDS Council, we have seen the impact of our collaborative efforts in trying to coordinate our response to this epidemic, and from day to day we are recording progress. The dynamic leadership of all sectors that are here on the South African National AIDS Council is testament of our commitment to place the interests of our communities at the center stage. We take pride in the fact that as South African government, we remain the main funder of the country's comprehensive response by almost contributing 80% of the resources that we use in our response. Today, We count amongst our victories the fact that South Africa has the biggest HIV treatment program in the world, with more than 4.5 million people on life-saving ARVs. Our antiretroviral treatment program has resulted to an increase in life expectancy of our people and low levels of mother-to-child transmission rates. This means that millions and millions of South Africans who previously had no hope of sustained quality of life now can live longer and are able to contribute in building a country, a South Africa of our dreams. The World AIDS Day is commemorated each year on the 1st of December, and it presents us with an opportunity for every community to unite in the fight against HIV, show support for people living with HIV, and remember those who lost their lives through this epidemic. Placing people living with and affected by HIV at the center of our efforts to defeat this epidemic has proven to be the correct course of action. This is consistent with the theme for this year, which says, communities make the difference. This theme resonates with our history of struggle. At the heart of apartheid and repression, our communities mobilized themselves in various communities to fight apartheid. They've built action groups, they've built solidarity, cohesion, they've built unity amongst themselves to fight the unjust government that was ruling people by repression. Our communities then drew a line in the sand and demanded a just society based on human dignity, demanded a non-racial society, demanded non-sexist society, and a democratic government. Our youth, our civil structures, our media, all of us, we stood firm behind a struggle determined to overthrow apartheid regime, and we succeeded. Likewise, the impact of the epidemic has brought pain and misery to many families in our townships, in our villages, in our communities. Once more, we are calling on our people to stand up, work together, unite against this epidemic. I am confident that as a people, we have managed to win a number of battles. The biggest battle that we've won is our freedom. And this battle is an easy one to win. Community actions, therefore, remains an important pillar in making change to happen, in shaping policy agenda and outcomes. If any of us doubted the power of community action in the making, can look at no further than the community of Eshowe in KwaZulu-Natal. This community, mostly remote, rural, was able to achieve what no other community in South Africa or in the continent has achieved insofar as our fight against this epidemic. In Eshowe, 90% of the people who are infected with HIV were diagnosed. That means they presented themselves, they tested. 94% of the people who were diagnosed with HIV and AIDS received treatment. They are on treatment now. And 95% of those who are receiving treatment are virally suppressed. That means they can live. They are able to do whatever they want to do. They can work, go to work. They can participate in building the country. So this community is the best example. This means that Eshowe has exceeded the 90-90-90 target that we have set ourselves in 2014, which has been announced by the United Nations Program for HIV and AIDS. We once again congratulate this community of Eshowe for this achievement, and I'm sure a number of us can learn from that community, which is a small community, a rural community. In the same vein, I am pleased that a number of our districts are coming closer to reaching the first 90. That means in a number of districts, we are coming closer to 90% of our people getting tested and diagnosed. We are coming closer to achieving the first 90 in a number of districts. Then that means after achieving the first 90, we must get all those people on treatment and ensure that they are virally suppressed. And we're also pleased that the first ever national TB prevalence survey results will be released soon. It's important that we all await those results because it will provide us with a more accurate data on how we are performing in terms of TB. And that survey will guide us on how best we should respond. Indeed, we are making progress in reducing the rate of new infections from an estimated of 270,000 in 2016 to 222,000 in 2018. It's a small difference, but in the right direction. Prevention should be the watchword. All of us must strive very hard to prevent this epidemic. It's one thing to go around, test. It's one thing to put people on treatment. It's one thing to take the treatment for a lifetime. But the best thing is that we should be more stronger on prevention. We have made major progress on voluntary male medical circumcision as an area of prevention, where close to 4 million men were circumcised at the end of March 2019. This is a significant achievement, as these men were not only circumcised, but also underwent HIV prevention programs, including testing. Whilst we make these welcome strides, we must intensify our program on prevention by employing every method available and possible to end this epidemic. We must tackle head-on all contributing factors to new infections. This including taking openly and frankly to our people, especially young girls, on issues of sexuality and the resultant risk of unprotected sex to potential infections and pregnancies. This fight should be led in all fronts. Therefore, political leadership and commitment is required from all of us, from our premiers across the country, from all our MECs for health in the entire country, from all our mayors, district mayors, local mayors. We must all stand up and ensure that AIDS councils are fully functional where we lead. We'll be relying on our communities to take up the task of holding these structures accountable. The call to action on this 2019 World AIDS Day, it's about recognizing the power of communities. Even in the face of other serious social ills, social challenges, unemployment, poverty, and inequalities, our communities are still standing strong. We should not despair. We should not give up. We should forge ahead. We must be inspired to find innovative solutions to ending these challenges, including ending AIDS epidemic in our lifetime. The community actions we are calling for should be about creating platforms for collaborative approaches in how we advance human rights for all. It should be communities making a difference in ending stigma and discrimination against key populations and those infected by HIV and TB. For us to win and end the dual pandemic of HIV and TB, communities must stop stigmatizing and discriminating against those affected and infected by these pandemics. Our call for community actions to make a difference, it's about mobilizing our societies to change their social attitudes, to change their norms, to change their stereotype, some of these stereotypes are a product of how we were socialized as we were growing up. We're calling on our traditional leaders to work with us to deal with the stereotypes, to deal with patriarchy. These are the social ills that continue to bedevil our nation. Now, these social attitudes that are at the heart of the ills we're experiencing today, which breed and perpetuate gender-based violence that is being visited upon women, girl children, the elderly, and other people in our societies. This, we want to say to our communities, this does not represent us. This does not represent Ubuntu and the human rights that were fought for when we're fighting for freedom. And we have committed ourselves when we adopted the new constitution and the Bill of Rights that we shall be forever, as a nation, protect the rights of those amongst ourselves who are vulnerable. So some of these new tendencies that are emerging amongst ourselves are foreign, and they don't represent us. They don't represent Ubuntu. Therefore, we must work and bring to an end any form of violence and discrimination against women and girls, including denial of right to protection, access to treatment and care, as well as the right to reproductive health. We must leave no one behind us, for human rights must be enjoyed by all, irrespective of gender and sexual orientation. Just as we fight to end AIDS epidemic, we should, with equal determination, fight to end the culture of gender-based violence. This gender-based violence is a bad mark to our democracy and to our freedom. Anything contrary undermines our fight to end the HIV and AIDS epidemic. As government, we will work tirelessly to ensure the speedy implementation of the National Emergency Response Plan to combat gender-based violence and femicide. In this regard, we take this opportunity to commend men championing change programs led by the Sanak Men's Sector through the Takuane Rime program. This program is spearheading one of the most robust men's mobilization initiatives in the country to address social ills perpetuated by patriarchy. Every day should be about community mobilization in all corners of our country to ensure that gender-based violence has no place in our society. We call upon men, those people who call themselves men. Do we have men inside the tent? Can men raise their hands? As men, we must say no to gender-based violence. As men, we must continue to love our children, our girl children. As men, we must continue to love our women. I find it very hard to accept that where there's love, there's also violence. I find it very hard to understand and accept that where there is love, there is also violence. Love and violence don't coexist, don't live together. Fellow South Africans, we wish to remind all of you that we launched the Cheka Impilo National Wellness Campaign last year to ensure that together we drive a concerted program that will reach the following targets by December 2020. By December 2020, we want to have screened and tested 14 million people for HIV, TB, sexually transmitted infections, and non-communicable diseases. By December 2020, we want to find and treat at least 7 million people who have diabetes, hypertension, and common cancers. By 2020, we want to initiate additional 2 million HIV positive people on treatment. By December 2020, we must find and treat at least 80,000 people of the 160,000 people that are estimated to be missing and having TB. These targets that I'm announcing will not be achieved without your willing participation. We can always achieve what we are pronouncing here if we work together as a nation. A healthier and a better South Africa begins with you and me. The time to stop losing many lives prematurely and unnecessarily because of not taking the appropriate action early enough, it's now. Let the future generation hail our work as community and health workers in bringing down the curtain on all preventable and treatable diseases. We need ambassadors for change of behavior. Well, today I got 2 ambassadors. I've announced them here. Those are ambassadors that will go out there and call for a change of our behavior. At the South African TB conference in Durban last year, we made an undertaking to donate a bus to the University of Zululand Choir, and I wanted the choir to be our HIV and TB ambassadors, and they've agreed. On behalf of government and the South African National AIDS Council, I have the pleasure to hand over this bus to you. From today onwards, you will be known as HIV and AIDS TB ambassadors wherever you will be. Even after you have left university, wherever you will be, you will remain ambassadors. Finally, as we prepare for the festive season, we wish to remind all of us to take care of ourselves and act in a very responsible manner. In everything we do, Even those things that you do in darkness, be responsible. On this World AIDS Day, let us remember all those who have lost the battle against HIV and AIDS. We must also not retire from reminding ourselves that defeating HIV and AIDS is possible in our lifetime, and that it is our collective responsibility to do so. I wish you, all of you, a memorable and a productive World AIDS Day. Thank you very much. Thank you. I want to go with the choir. Firstly, call the rector, so that we can hand over the pass. Let's hand over the pass, and the pass is standing outside here. There's a paper there. It's a registration paper.
Yes.
Yes.
Higher. In the performance stage. The rector must come this side. Thank you, thank you.
Thank you. Where's the rector?
Rector, this side. They're not performing. Is the conductor here?
Yes.
I will call them and Zoom.
Yeah.
Yes, come this side. You are not a performer. There's a conductor here.
I'll go with these people outside there and then we call.
Yes.
Yeah.
Thank you so much.
Thank you.
For your work. Where's the mic? Mic.
I was saying this is the key for the pass. And these are the registration papers to show that the pass is yours. You can come, let's go and see the pass.
Sing a song to the pass.
Meanwhile,
Maausi, when they go to the bus, you must come and perform.
Meanwhile, we're looking at the bus. I want to see the provincial AIDS Council. The deputy chair of SANAC will call all those names. When I come back, we officially inaugurate that provincial AIDS Council. In the midst of that council, there will be the MEC and the Premier. They are part of that council.
Thank you. Colleagues, while we're waiting for DP to return, I will be calling on all the provincial council. We will wait for the other members to return, but in the meantime, the PCA co-chair, Mr. Pinambi Mano, I'm also calling the members of PCA, starting with the MECs. The first one is standing right here with me, MEC of Health, MEC Desbo Mohono, please also join us. MEC Sillo Lehari, MEC Gordon Kekakilwe, MEC Ginetswi Musenogi, MEC Mapefo Matsemela, MEC Wacheng Molapisi, MEC Buitume.
All right, that's the Deputy President there. Of course, he, as you would have heard there, he was handing over the keys to the bus that, he's hoping that it will be assisting those in the area in the northwest there in Orkney that will be traveling up and down to access treatment. I am still sitting in the studio with TAC's General Secretary, Anele Yawa, just to speak about the commemorations of World AIDS Day today. And one of the biggest issues that I heard you raise this morning and leading on to this afternoon was the fact that the TAC is in fact opposed to this event that's currently taking place in the northwest. Just looking at what's currently happening now, there's some kind of jubilation, and we heard the Deputy President giving us numbers of how well South Africa is doing and how well the government is doing in terms of addressing the HIV/AIDS, the scourge of HIV and AIDS in the country. But you've said that it's still, this is such a waste of taxpayers' money, and that you even called it a picnic. And I'd really like you to go into why you're opposed to this event, and why you even called it a picnic.
Okay, one, it is a picnic in the sense that most of the people who are there were flown from different provinces of the country, were booked expensive hotels only to pose in front of the cameras and listen to all the political speeches. From there, all those people will go back to realities, back to their communities where they see people dying without getting adequate healthcare services. Two, in our view, it was going to be good, I repeat, it was going to be good if, let's say, we were going to identify one community in that province and say either in this community there is a high HIV and TB infection or a high HIV and TB defaulter rate. We bring the president and all those VIPs, MECs and other people who like to pose next to the politicians. We take them to that community. We bring mobile clinics full of medicines and stuff. We encourage all these politicians to do door-to-door, to distribute condoms as part of sending a message on prevention. We encourage them to engage to a community and make sure that people who are on treatment are adhering on treatment.
Okay, let me just interject.